Hello, I'm Peter Howarth. I'm Professor of Allergy and Respiratory Medicine in Southampton and also hold a part-time educational role with GSK. And I'm here at the WAO meeting in Jerusalem, the WISC meeting, and I wanted to talk to you about the difference between difficult to control asthma and severe asthma. While severe asthma is certainly a subpopulation of those with difficult to control asthma, not all those with difficult to control asthma have severe disease. And that's because we recognize that difficult to control asthma and the escalation of therapy happens because of persistent symptoms. And those symptoms may arise because of asthma, but may arise because of comorbid conditions. And before you escalate therapy in patients with severe asthma, and you've ensured that they're taking their therapy appropriately, you need to think about the presence of those comorbid conditions. So we readily identify that individuals who have other lung diseases, such as smoking-related COPD, bronchiectasis, cystic fibrosis, may present with symptoms or lung function that fails to improve with standard asthma therapy, and it's because of those conditions and not because of their coexistent asthma. We also recognize there may be other eosinophilic disorders, such as eosinophilic polyangiitis, Churg-Strauss syndrome, or hypereosinophilic syndrome, that may also present with asthma as difficult to control, but is part of a more systemic disorder. And clearly there is well recognized that there are patients who present with persistent symptoms that are related to psychological dysfunction, such that they hyperventilate, or may have other conditions such as vocal cord dysfunction. And in those instances, escalating therapy for asthma and the consideration that they have severe asthma would be inappropriate. We also recognize that there are other coexistent diseases such as upper airways disease, rhinosinusitis, allergic rhinitis, and also gastroesophageal reflux. And the guidelines recommend that those conditions should be treated before you assess someone has a severe disease. So clinically, it's important to consider all these other aspects before you escalate therapy and assign someone as having a severe asthma.